everyone, welcome to our YouTube channel Shree Swaminarayan Physiotherapy College, Ahmedabad. Here I Dr. Siddhi Pandya, working as a lecturer at Shree Swaminarayan Physiotherapy College, Ahmedabad. Before I start this presentation, I would like to request all viewers to like, share and subscribe our YouTube channel, and don't forget to click the bell icon to get the latest updates. So today I am going to discuss about the incentive spirometer. So in this presentation, we are going to discuss what is incentive spirometer, techniques how to use incentive spirometer, its physiological basis, indication, contraindication and its effectiveness. So let's see what is incentive spirometer. Incentive spirometer is a form of ventilatory training that emphasizes sustained maximum inspiration. So patient inhales as deeply as possible through a small handheld spirometer that provides a visual or auditory feedback. So that means patient will get the visual biofeedback that how they are performing, whether the target inspiration was reached. So there are mainly two types of spirometer, 3-ball and 1-ball spirometer. 3-ball spirometry is basically flow-oriented device, and 1-ball spirometry which is related with the volume-oriented device. Nowadays, there are certain types of spirometry is available, which includes different types of images or cartoons for pediatric group of patient, which encourage pediatric patient to achieve maximum target inspiration. So now we'll see how to perform incentive spirometry. So first, patient is given a comfortable upright position. Patient accessory muscle of the inspiration should be relaxed. Appropriate flow or volume is selected. Spirometer is kept at the level of mouth, and at the end of sustained maximum inspiration, patient is instructed to hold the ball at the same position at least for 3 to 5 seconds. And frequency of performing incentive spirometry, which is around 10 to 15 repetition for 3 to 4 times per day. So now we'll see on which physiological principle incentive spirometry is working. As we know, it is working on sustained maximum inspiration. So sustained maximum inspiration is slow deep inhalation from functional residual capacity to TLC, that is your total lung capacity, followed by 5 to 10 breath holds, which is very much important. SMI is functionally equivalent to inspiratory capacity maneuver followed by a breath hold. So as we know, our lung is protected with the pleural layer, and there is two types of pleural layer, that is visceral pleura and parietal layer of pleura. In between the pleura, there is always negative pressure is maintained, that is -4 mm Hg. This negative pressure which varies during each phase of the ventilation, but at the maximum inspiration, your pleural pressure will be more negative, which is around -30 mm of Hg, and more negative pleural pressure will help to expand your alveoli in different restrictive lung condition. So now we'll see what are the indications of the incentive spirometry. In presence of pulmonary atelectasis, presence of any restrictive lung condition such as pneumothorax, hydropneumothorax, or patient is related with the spinal cord injury such as quadriplegia or dysfunctional diaphragm. Presence of condition predisposing to atelectasis such as upper abdominal surgery, thoracic surgery, and surgery in patient with the COPD. Contraindication of incentive spirometry are if patient cooperation is absent or patient is not able to understand or demonstrate the proper use of this device should be contraindicated. Presence of an open tracheal stoma is not a contraindication, but it requires specific adaptation of the spirometer. Now we'll see what are the effectiveness of this incentive spirometer. It's said to improve the collateral ventilation because alveolar interdependence via pores and cones and channels of Lambert and Martin. So, as the collateral ventilation is improved, it will lengthen the period of time in which inspired oxygen held within the alveoli. As the oxygenation time is improved, so more oxygen will be circulated in pulmonary circulation. So this image shows the collateral ventilation. So there is a intrabronchial channels, that is the channel of Martin, bronchoalveolar channels, that is the channel of Lambert, and interalveolar channels, that is pores of cone. So with the help of incentive spirometry, we can improve the collateral ventilation and we can improve the oxygenation and we can improve the pulmonary oxygenation in pulmonary circulation. So it replenishes surfactant in which lost in presence of atelectasis, which is achieved by expanding of the alveoli and stretching of type 2 pneumocytes with deep breathing exercise. And the surfactant role is to reduce surface tension, thereby prevent the atelectasis. And ultimately it will increase the strength of inspiratory muscles. So this is all about the incentive spirometry. Thank you for the watching.